Hi, this presentation aims to provide a clear and practical guide to understanding diagnosis of dementia, and this is meant for individuals who don't have a medical background. We'll explore how to recognize dementia and the key signs to observe at home, and what is the diagnostic process in a given setting in the clinic, and then what are the medical assessments involved. So, what is the agenda? First of all, we'll help you to recognize dementia beyond just memory loss, which is a common issue. Many people visit the clinic because of memory lapses, and their concern is that this might be dementia. So the first issue is to try and find out how to identify that this is not just the usual memory lapses, but actually dementia. Next, we will identify the key signs to observe in the everyday settings. Then we will review the diagnostic process and whatever is typically used by doctors. Finally, we will explore the medical assessments that support the diagnosis of dementia. So first of all, dementia is more than just memory problems. It also involves cognitive problems and personality changes, changes in mood, behavior, orientation, and various other things. Most importantly, these tend to interfere with the daily life and affect the ability of the person to perform his daily activities. And this talk is to help you to understand when to seek medical advice. So first of all, you need to observe the pattern of cognitive decline, which has to be consistent. Temporary lapses may not be dementia. You need to identify ongoing difficulties in thinking and reasoning that progressively worsen over time. And these should have an impact on daily tasks and the ability of the person to perform familiar tasks. We should also differentiate between occasional forgetfulness and the really serious cognitive impairments that require attention. So look for consistent and progressive difficulties in thinking, reasoning, and problem solving. These changes often affect the ability to perform familiar tasks and should not be dismissed as occasional forgetfulness. So, how do we differentiate dementia from normal aging? Normal aging also involves some degree of changes in the memory capacity. People are slower to think and to remember stuff, and that a little bit of it is quite all right. So, it is usually minor memory lapses. Most people say that after a little effort, they can